Summer heat safety. How common medications raise heat-related illness risks. The hidden dangers of certain medications during hot weather might surprise you. As summer temperatures soar into the 90s and beyond, staying safe in the heat becomes a critical concern. But here's where it gets controversial. Did you know that some medications can actually increase your risk of heat-related illnesses? In today's Monday Morning House Call, Dr. Jenora Parker, who manages specialty and outpatient pharmacy services at GBMC, sheds light on this important issue. She explains which medications you need to be cautious about and how to recognize the signs of heat-related illnesses. As the mercury rises, it's essential to be aware of how your medications might affect your body's ability to handle the heat. For instance, certain drugs can impair your body's natural cooling mechanisms or increase your susceptibility to dehydration. This is the part most people miss. Even common medications like antihistamines, diuretics, and some antidepressants can pose risks. Dr. Parker emphasizes the importance of understanding these risks and taking proactive steps to protect yourself. She advises staying hydrated, avoiding excessive sun exposure, and consulting with your healthcare provider about any concerns regarding your medications. So what do you think? Have you ever considered how your medications might impact your ability to cope with the heat? Share your thoughts and experiences in the comments below. Let's start a conversation about this often overlooked aspect of summer safety. Medications and heat sensitivity. What you need to know this summer. Are your medications secretly making you more heat sensitive? Here's what you need to know. As the summer months bring scorching temperatures, many of us are left feeling drained and exhausted. But have you ever stopped to think that your medication might be making things worse? It's a startling reality that certain medications can increase your sensitivity to heat, leaving you more vulnerable to heat-related illnesses. Millions of Americans take these medications, often without realizing the potential risks. In fact, many people take multiple medications that can compound the danger. According to Centara Health clinical pharmacy specialist Sarah Dawson, this is a concern that should not be taken lightly. So, which medications are the culprits? The list includes antidepressants like Prozac, topical acne treatments like benzoyl peroxide, blood pressure medications, antihistamines, antibiotics, and even painkillers like ibuprofen. But here's where it gets confusing. Some medication warnings advise staying out of the heat, while others caution against staying out of the sun. What's the difference? The answer lies in the specific risks associated with each type of medication. When medications warn against heat exposure, it's because they can increase your risk of heat-related illnesses like heat stroke, heat rash, fainting, and dehydration. On the other hand, medications that warn against sun exposure can cause your skin to become hypersensitive to UV rays, leading to severe sunburns. So what can you do to stay safe? Doctors recommend staying hydrated, staying cool, and staying covered with clothing or sunscreen that has an SPF of 30 or greater. But that's not all. Your medications also need protection from the heat. If you receive mail-order medications, be mindful of the temperature they're exposed to. Medications should be kept at room temperature, away from direct sunlight. If you're not going to be home when your medication is delivered, consider having it sent to your office or asking a neighbor to collect it. And what about medications that you carry with you, like insulin, inhalers, or EpiPens? Be careful not to leave them in a hot car or exposed to direct sunlight for extended periods. This can cause the medication to degrade, rendering it ineffective. If you're planning a day out at managing your mental health meds in the summer heat, expert tips from Tufts Psychiatrist. Extreme heat waves can significantly impact mental health, particularly for those taking certain medications. Dr. Varsha Radhakrishnan, a psychiatrist at Tufts Medical Center, sheds light on how soaring temperatures can exacerbate psychiatric symptoms and increase the risk of mental health crisis. Here's why you should be cautious. Why heat matters. Research indicates that heat waves are linked to a rise in mental health issues, including increased suicidal tendencies, emergency department visits, and heightened anxiety and sleep disturbances. The heat can also worsen existing psychiatric symptoms. Medication and heat sensitivity. Some medications, such as mood stabilizers, antidepressants, and antipsychotics, can affect your body's ability to regulate temperature. They might increase sensitivity to heat, cause dry mouth, and lead to more frequent urination, all of which can contribute to dehydration and other heat-related complications. A critical caution: never stop taking your medication without consulting your doctor, even if you suspect heat sensitivity. Abruptly stopping medication can have severe consequences. Instead, discuss your concerns and symptoms with your healthcare provider. Practical tips to stay safe: stay hydrated by drinking plenty of water. Ensure you're in a cool, air-conditioned environment whenever possible. Use fans to help keep cool. By taking these precautions and maintaining open communication with your doctor, you can manage your medications safely during hot weather. Remember, your health and well-being are paramount, so don't hesitate to seek professional advice if you notice any concerning side effects related to heat.